Hello, this is my poster assessment by Andrew Weary. And first we're going to go over the risk stratification, and the subject that I used was my mom. And all the contact information, and she's never had suspected heart attack or stroke, or never a history of asthma or anything. We have a relatively healthy family, and she has not had any problems when engaging in physical activity. And from this, from being a healthy adult, she does go out walking about 5 days a week for 30 minutes at a moderate intensity. From this, she does not currently take any medicine or has not taken any medicine in the last 6 months. And from this risk stratification, you can see that she is an apparently healthy adult. She does not have any factors or anything that may interrupt her life. In the part Q, she does not have any heart attacks or heart conditions. And last but not least, she does not have any risk factors, so she's a low risk. The first assessment that took place was the heart rate. In this video, I'll be demonstrating how to find someone's heart rate. So first, you want to make sure they're in a nice relaxed position with their arm flipped over, as that gives a more accurate reading. Next, you want to use your pointer and index finger and locate their radial artery, which is on the forearm. And for this purpose, we're just going to hold for about 15 seconds, but usually you'll find someone's heart rate on their radial artery for about 1 minute. Alright, so I got a number of 20, which then we multiply that by 4, which is 80, and we'll get that in beats per minute. The second assessment that was performed was blood pressure. So for this assessment, you will need a blood pressure cuff and a stethoscope. In this video, I'll be demonstrating how to find someone's resting blood pressure. So first, you're going to make sure that your patient is seated for at least 5 minutes, that has a chair with back support. Next, you want to wrap the cuff around the upper arm at heart level, and you want to align that cuff at the brachial artery. So our brachial artery is going to be right above the crease that we have in our arm, and that's where you want to place the cuff. When you put that cuff on, you want to make sure that's not too tight, as it will have an effect on the reading. And next, once you have the cuff successfully on, you want to place the stethoscope right on the antecubital space that is on the brachial artery. Once you have successfully placed the stethoscope over the antecubital space, you want to quickly inflate the cuff to 20 millimeters mercury above the first Kirchhoff sound. And once you have reached that, which is going to be about 200 mercury, you want to slowly release the pressure at an equal rate by 2 or 3 mercury. And the first sound that you hear will be the systolic blood pressure, and the second sound that you hear will be the diastolic blood pressure. The third assessment that was performed was skin folds, and for this you'll need a caliper and a pin, just to mark where you're going to take the skin folds at. And the men and women have different skin folds. For the males, it's going to be abdomen, thigh, and chest. And for the woman, it's going to be the triceps, the suprailiac, and the thigh. And for this, we're just focused on the woman's skin folds. In this video, I'll be demonstrating how to successfully perform skin folds. So the 3 main sites that are used for women are triceps, suprailiac, and thigh. And all measurements should be on the right side of the body with the subject standing upright. First, for the triceps, we're going to use a vertical fold for this one on the posterior midline of the upper arm, halfway between the acromion and olecranon processes, with the arm held freely to the side of the body. And once you locate that spot, which should be about right about there, you want to give them a little pinch, and you want to read that. You want to wait 1 to 2 seconds before reading the caliper, and then once you have that number, you want to make sure that you record it. The second skin fold that can be used for women is the suprailiac. So unlike the triceps, which is a vertical fold, we're going to be using a diagonal fold in the suprailiac skin fold. And the suprailiac can be found in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. So it can be about right here. And once you have that spot, you want to give it a little pinch. And using your calipers, you want to use that diagonal fold and hold for 1 to 2 seconds. And then once you have that number, you want to make sure that you record that. Last but not least, we have the thigh skin fold. So like the triceps, this is going to be a vertical fold. It's going to be found on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, which is also known as the hip. So you're going to, about right there, it's about halfway between, and you're going to use your calipers using that vertical fold, and you want to place those calipers on that spot for 1 to 2 seconds, and then get that reading, and then you also want to record that number as well. The fourth assessment that was performed was the sit and reach test. For this, you'll need a yardstick in centimeters, a sit and reach box, but in this case we just use a normal box since we didn't have a sit and reach box, and a participant. And the participant will be sitting upright, and they will not cross their arms in front of each other. And this test will go until the max reps has been achieved, or once their hamstrings do come off the ground, and that will result in failure of the test. In this video, I'll be demonstrating how to do the sit and reach test. So first, the client should sit without shoes and the soles of the feet against the sit and reach box, but for this purpose, we just have a box and with a 0 mark at the 26 centimeters, and the inner edges of the soles should be 6 inches apart. Second, you're going to let the client reach as far as possible, holding the position approximately for 2 minutes. And usually they have their arms like this, and the fingertips can be overlapped and should be in contact with the measuring portion of yardstick and the sit and reach box. And once you do that, the score is the most distant point reached with the fingertips, and you should record the best of 3 trials. And when doing this, when performing this, testers should ensure that the knees of the participant stay extended and that the hamstrings also stay in contact with the floor. And here is a demonstration. You got about 42, and according to the tables that we have in our book, that is scored at the very good mark.
I think you should.
The fifth assessment that was performed was the partial curl-up test, and for this you'll need 2 pieces of tape, 6 inches apart from each other. In this case I used a pen and a tape measure, and you want to go until failure, which results when the shoulders do touch the ground, or once a max of 75 reps has been achieved. And also for this, you need a metronome set at 40 beats per minute. You can go higher, but that will be a faster and make it more difficult to participant. In this video, I'll be demonstrating how to do the partial curl-up test. So first, you want to start out with the patient in the hook-lying position, just like this. You make sure their shoulders are off the ground and also their head. Second, you're going to place a piece of tape at about the fingertips and a second piece of tape at about 6 inches from the first piece of tape. And also you want to have a metronome handy for this, as they will, on the first beat, they will come up, and on the second they'll go back down, and they'll keep on repeating until a max of 75 repetitions has been calculated, or until failure. So here's a little demonstration at 40 metronomes. For this last assessment is the step test. For this, you'll need a metronome at 40 beats per minute or higher, a 6-inch step, and also a timer. In this test, they'll go for 3 minutes, and they'll want to switch lead foots, as said later in the video, at about 1.3 minutes, which is halfway between. And after the video, I'll also include a diagram of the VO2 that was calculated from the step test. Here's a video how to successfully perform the step-up test to measure VO2 max. So first, you want to have the subject warm up for about 5 minutes. Some exercises include jogging or warming up on a treadmill or bike. Second, instruct the subject of the 4 rhythm cadence, which is up, up, down, down. So right leg goes up, left leg goes up, right leg goes down, left leg goes down. And this test will be performed for about 3 minutes. So at the 1.3 mark, you want to make sure that the subject switches lead leg. So if the right leg starts, you want to make sure that the left leg starts to decrease fatigue. And while you perform that, you want to make sure you have a metronome at 40 beats per minute, and each
each tick of the metronome. You want to make sure that they're stepping up or stepping down, and if they don't do that, then the test should be stopped. So here's a little demonstration. And from the subtest VO2 assessment, I found she had a VO2 of 29 and she's 51. So from the table that I found, she is in the category in our age group of good.
Through many of tests, there could be some improvements that could be made in order to get more accurate results. In the first test that we did, the measuring heart rate, I think it would have been better to also try to do more than one trial and also do one maybe in standing just to see the difference in those heart rates and see if they're similar, and that would help validate the numbers that we got when doing it the first time. Also, some other improvements that could be made was having the necessary materials in order to perform these assessments. So for like the sit and reach, we just had to use a box instead of a sit and reach box, and I think my mom could have probably stretched a little farther if she had that sit and reach box, just because it would have been more comfortable. Another example that would have probably made the test a little bit more smoother and better results would have been to inform my mom of the proper methods to conduct the exercise. All this would allow her to be able to know ahead of time what she was being tested instead of right before the assessments took place. And that is all. Thank you so much for watching this.